So again, welcome. So often menopause is described as something that we have to get through or endure. And it can be hard. But what if we told you that you could change that narrative and even find a way to thrive while you're in menopause? We know that menopause is a natural process and a frustrating one, and every person has their unique experience. Some people have very mild symptoms, others have really intense symptoms, and the range of symptoms can be very, very broad. But with the right toolkit, you can manage your symptoms and you can continue to live a full and flourishing life. So, having said that, I would love to introduce our expert today. Shakika Misher is a board certified nurse practitioner with a doctorate and over 15 years of experience in women's health. Having personally faced the dismissal of perimenopause symptoms, she brings both professional insight and lived experience to her work. Passionate about breaking down barriers and stigmas that hold women back, she is on a mission to empower women to thrive through every stage of life. Dr. Misher is thrilled to be here today, sharing her voice and vision for change, and we are so happy to have you.
I am super excited. This is my passion, my love from it thriving. Like we thrive through this from a huge component that as we're going through this journey, it's an absolute journey. It's unique from it because it's our own. But being able to stand in your story, to be able to share your story, and to have a community like this is so powerful and needed. And sometimes we forget those moments of connection or just knowing, like, hey, I'm feeling this and I'm not alone from it. So that's what it's all about today as we dive into some questions. And I shared some of my expertise with you, but I do want you to acknowledge and recognize that also, although I am an expert in this field from it, you are the expert of your body from that. So that's so key, so powerful. And no matter what you're doing in life, but especially within your health, you're the expert of that. So listen to your body because your body talks to you. So let's get started.
Absolutely. I love that. I think we know when something is off, when something's not right. And yeah, trusting that voice is so important.
Yes.
So I thought the best place to start is just to give our audience a brief overview of what menopause is, when it begins, typically, so it can vary, and how long symptoms can last.
Such a great question and so needed from him. So, when we think about menopause in itself, menopause is a point in time. It's a natural transition. It's a powerful transition in a woman's life. You're going to spend over 40% of your life in some phase of menopause from it. I always like to think and just remind us that it's not an ending, it's an evolution from it. You're evolving with it. When I say a point of time, menopause is just that point. It marks when you've been 12 months without a period. So no bleeding, nothing, spotting here and there is 12 months without it. From it. And if you have bleeding in between, that restarts that 12-month period time frame for you, which is can be a tough thing to kind of go through. For many of us, when we think about the time frame, perimenopause and menopause shows up within our 40s or 50s. So when I say perimenopause is anything all the time frame before that point of time when you've been 12 months without a period. So everything up to that point is all perimenopause. Then you get menopause, which is that day that you've reached that 12-month period. And then after that is postmenopause from it. So we're all dealing with menopause in some shape, form, or fashion from that. So between the 40s and 50s, when we start, most of us start seeing some symptoms of perimenopause. However, it can occur earlier from it. Genetics play a part in that. Our environmental can play a part in that as well from it. And oftentimes we are experiencing some type of perimenopause symptoms and we don't realize it from it. It takes women on average 6 to 7 years before they get an actual diagnosis that's linked to menopause. Because is it you're stressed, you're tired, you're juggling multiple things? Is it your thyroid? Is it your blood pressure? Is it just a natural part of aging? There's so much that's going on, and menopause impacts it all. So it unfortunately takes a long time, but I'm here to change that and just to have that voice from the provider standpoint, but also from our women's standpoint for us that we need that from it. So when you think about how it begins and where then you think of the common things of hot flashes, night sweats, mood swings, weight gain, especially around your belly, from that anxiety, brain fog, are the most of the common things we hear about. But there's also the dry, itchy skin, the ringing in your ears, the burning mouth syndrome, from it, vaginal dryness. There's a lot of other things that's present there, from it. So just be able to realize that you're not alone and we're standing with you. And the more you know, the more power you have as well.
Absolutely. I love that you mentioned how there can be different things going on because when I talk to clients, it's often I'm going through menopause and there's always an and, there's always something else that's happening. Like my kids are moving out or my kids are doing this or relationships are changing. And it brings so much added pressure and stress when you already have something going on that's stressing you out, and then you have all these symptoms that are just impacting that more and more.
It is. It's key. And I think another piece that's so important to bring up, from that I mentioned before about it being unique. We live, here we are, we're in a webinar from it. Like you guys are all over the world and coming in together, which is so powerful.
Yeah.
But it's also one of the things that can be, I wouldn't say a barrier. I think it's just something that we have. It's a guardrail, really, something we're having to network through because we see so much many things as on Instagram or as on any type of social media, or my mom did this, or my sister, or the person in my community. And I want you to realize, or just to be able to recognize that although someone else went through menopause a specific way or certain, that may not be your story. You may
Mhm.
have a part of it and you may have something like totally different that kind of sneaks up on you and was like, oh my gosh, what happened there? From like, what is going on, with it. I mean, that was me. I got on a swing and I was like, oh my gosh, like what's everything's spinning? What's going on? From that. So try to recognize this as an individualize as much as possible, from it, and talking to others, as well as key is from there.
Absolutely. I love that you mentioned that. Unique experiences are very common. I had very few hot flashes, but I still have a ton of joint problems. Like
Yes.
what hurts today? What's it going to be when I wake up this morning that's going to hurt? So you never know. And sometimes those lesser known symptoms, like you mentioned, the itchy skin, people might not realize that that's menopause, but it can be.
Mm-hmm.
So when you think about all of these different symptoms of menopause that we're experiencing, um, we're here to kind of talk about this toolkit, right? And a toolkit that we can build to create that flourishing, not just white knuckling it or getting through, right? So, what are some main areas or main things that you would recommend people have in their menopause toolkit?
Oh my gosh, so powerful. Yes. Um, Baby, we need this, from it. We deserve to have support. We deserve to thrive from it, not suffer in silence or feel like we're isolated. So having tools in your toolkit and your belt is key and so powerful from that. When I think about it from a standpoint, from hormone therapy to different medical options to, holistic pieces, from it as well, it's in your entire body, and we all need that. I think the most powerful tool that you have is knowing your body and listening to your body, from that. Stand in that power. From a member, I said, you're the expert of your body. You know your body the best. We can read so many things through textbooks and our training and education and clients that we see on a day-to-day basis, but that doesn't reflect you, from that. And I always like to tell, my clients and even those around or when I, sharing different things as well, is that your experience may not be the experience that was in the textbook or experience someone else had, from it, or it hasn't been researched enough. Especially with women of color, there's not a lot of research and things that's out there, from it. So just because it's not written doesn't mean it's not done or not right to experience there. So we need providers that recognize that understand it, that has that active listening. But we also need us as women to have that same voice and advocacy from them. So when you go in to your provider's office, walk in with confidence or show up in confidence if it's a telemed, from that, and share your story and your expertise. And if
Mhm.
you feel that, I wasn't heard, I was, dismissed or anything, grab another opinion, from there. Um, you it's your body. Negotiate with that. Go seek that. So I think that's super important. The next thing I would say to add to our toolkit would be nutrition and movement from it. You were talking about our joints and things from it. Oh my gosh. Estrogen shows up everywhere, head to toe from this. So those achy joints, estrogen is anti-inflammatory. So when we're going through perimenopause, our estrogen is like a roller coaster from it. And when you're in menopause or post-menopause, your estrogen levels that continue to decline. And that anti-inflammatory pieces are gone there. So you do see those feelings of my joints hurting from it. I got the dry, itchy skin with it. So it's so important to drink your water, get your water out, drink tons of water, get out there and movement. Movement is key from it. Eating what you're fueling your body's going to fuel back to you. So be mindful of what you're putting into your body from it, staying away from sugary drinks, from that processed foods. Caffeine is also a corporate from those. We love our caffeine, we love our coffee and things from it, but you're dealing with hot flashes and those type of things, those can be fueling it, spicy foods. So it's again getting to know and keeping a diary. And when I say keeping a diary, that brings me into my next one of symptom management from that. A lot of times when we go into our provider's office, and I've been guilty myself, even as a provider, I go in and I have this thing that's on my mind, but I've been sitting in that waiting room forever or things from it, and now I'm frustrated and I just want to get out and I don't get my questions answered because I'm ready to go. I got the next thing that I need to do from that. And what I've learned is going into your provider's office, whether it's in person or in virtual, you have to come equipped from it. So very similar, like you're going to a job interview from it. You're going to an interview for you, for your body. So bring in your symptoms, track those from the track when you're having difficulties with sleeping from that, or when you feel like you're irritable, how does that align with your cycle? Or maybe you don't have a cycle from that. What does that look like on the daily basis? The more information that you have, the more you can grab on to your provider and say, hey, this is what's happening to me and it's specific. Because remember, this is an individualized approach. And then the last thing I would like to say about this is what I've talked about and hit on, which is so powerful and key, is knowledge and advocacy from those. There is power in standing in and knowing what's happening in your body from that. There's strength in asking questions from it, researching your symptoms, naming things that you're feeling. Too many of us are taught to tough it out from it, but silence helps no one from it. You're toughing it out, but you're by yourself, doing it and suffering through that. That doesn't help you and it doesn't help others from that. We need more education that's geared for us as women to teaching us what's happening in our body. It's so unique that we learn so much about our periods going, for a teenage and things from it. We learn about pregnancy, and then it's silence from there. We don't
Yeah.
learn that, that reverse effect of what's going on in our second part. And I think that's so powerful and a key piece that we need to kind of wake up on with it. This isn't just a health transition that you're going in. It's a call for you to take up space, to demand care and support for yourself and for others around you. So when you build a toolkit with true intention, so building it with intention and reclaiming your body from it, and remembering that menopause is not the end; it's your beginning. And I got it. You got it. We got it together.
Yeah, I love that. I had to laugh when you said nobody teaches us. We learn about pregnancy and menopause. And for me, and I had some pretty tough pregnancies, but menopause was still harder. It was still harder. And I didn't have great pregnancies. They were hard. But yeah, it does kind of seem like all of a sudden it's just crickets, right? And when
Yeah.
you ask your doctor, it's like, I don't know. And you know, where do I go? Right. So that's a great point. I think, having the knowledge, you can go to the Stella website. There's tons of blog articles. If you're in the Stella app already, you can go into the Stella app and find tons of articles just to kind of learn about like what is going on, why is this happening, what are some things that I can do. Because as you mentioned with the toolkit, there's so many different ways to approach your symptoms, and sometimes approaching them in different ways at the same time is really effective to helping you to feel better. So with that in mind, Um, Breaking down our toolkit a little bit, I wonder if you can talk a little bit about clinical treatment, because I know we have questions about clinical treatment and what that can look like.
Mhm. For sure. From it, oftentimes questions like, "Oh, what is this hormone therapy?" From it, what's going on there? Why is it first line or recommended by healthcare professionals? From it, and remember, as I talked about our estrogen, estrogen is one of our biggest. Progesterone is also present there, and it's truly a roller coaster ride that you're on, and you feel it for sure. From the things show up with hot flashes, your night sweats, distribution with it when you're waking up at 2 o'clock in the morning from it and can't go back to sleep from that. So you can think about the different types of hormone therapy that could be there. Estrogen therapy is one from it that can be utilized. There's some things that you have to dive in as an individual, like do you have a uterus? Do you not have a uterus? And things as well that you'll get into with your provider from it. But estrogen therapy can come in with pills, and come in a patch, it can come in gels, vaginal inserts as well. And they really help to relieve things like our hot flashes, the night sweats, vaginal dryness, things that's symptomatic within our body from it. Outside of that, and when I mentioned like the vaginal creams, that's one that's not systematic from us. So everything else is in our blood system, our bloodstream. You can identify it within blood work. But if we're utilizing just some inserts from us, such as the creams, that's local and it stays where you put it from that. And that's really important for blood volume and streams getting there to kind of wake up those tissues because the estrogen has been removed from it as well. There's combined estrogen progestin therapy that's super important, especially if you have your uterus from it, is where you're combining both of those estrogen and progestin together for that protection, but also getting the same benefit. Still comes in those same forms, a pill, patch, you can be able to combine that. And it really helps to protect your uterine lining. So that's the difference. Do I have a uterus from it? Do I want to protect that lining to have any overgrowth and things as well? And then the last one I mentioned is that low dose vaginal estrogen, where it stays right where it needs to be from that. And that's in key if you're having things like dryness from it, painful, interactions. And it's so important to be able to utilize that you may not get that benefit from a patch that you're putting on from because it needs to be localized there. And with that reason, you can see a combination that I may have a patch, I may also have a peel, I may also have a cream from that. But someone else may only be doing, one piece of that. And you find that niche that best fits with you. The other question I often get a lot is like, okay, so now I know about this hormone therapy. When do I start? When should I begin from that? And that's individualized, truly, and things for me. You get to decide. Some wants to start out with only holistic things, and that's great as well. Getting outside, walking, meditation, this kind of resetting are key from it. But if you also wanted to implement things like hormone therapy from it, when should you start? It's always important and great to start during perimenopause when you're experiencing that to help to support from it or within 10 years of your last period. So that gives you a large area, a range to kind of start it. And the reason why that is that the earlier you start, the more benefits you have for long term. Things like from your hot flashes, sleep improvement, mood stabilization, from a protection of your bones, osteoporosis. Remember that estrogen sneaks in, that it puts us as our estrogen levels decrease, puts us at greater risk of having fractures and broken bones and osteoporosis from that. So adding in the hormone therapy can really assist that. Again, it's not a one shoe fits all from it. Your age matters, your health history matters, your risk factors from that matters from that. Looking at things from breast cancer to blood clots to heart disease from that. So you find in a provider that peels back all those layers that we have from that to find the unique position with it. And like I always like to encourage patients when I meet with them, we start with the regimen, but it doesn't mean that's the regimen we're going to end with from it. It's not like a light switch that you start with anything, even if we're doing holistic and we're going to add walking in. It takes time from it, so it's not microwavable. It's not a light switch or anything. So give yourself time. And when I say time, we're looking at that 6 to 8 week window from it, just seeing like, oh, this works, or I've seen this, or nope, we need to do a little bit of change from that. But if something comes up in between it, don't feel afraid to reach out to your provider. It's like, I've tried this, but this ain't quite working for me. Do we have different options? Because sometimes we don't need to wait that long from that. So then, we know your options and your possibilities as well.
Yeah, I'm so glad you said that. That's a great point of, giving your body that time to find the right mix of treatment and lifestyle changes is so important. And then,
Mhm.
kind of along that same line of thinking, I'd love to talk about lifestyle choices and changes that we can make. I was not able to take hormone therapy, so I am real familiar with this from a from a personal standpoint. And I can say that lifestyle changes that I made absolutely did make my symptoms better. It took time, just as you said,
Mhm.
but 100% helped symptoms and continues to just help me age in a really powerful way, despite all that joint pain. So
Right.
yeah, I think if you could talk a little bit about lifestyle changes, how that
Yeah.
kind of helps with the symptoms as well.
Perfect. We can. One thing I also like to mention before we go into the lifestyle changes from it is oftentimes I'll get a question like, what question should I ask my provider as I'm
Oh,
going in from it, especially when you're dealing with things such as like the hormone therapy that we was just speaking about. So these are my top 5 questions I encourage you to kind of think about from it. Ask your provider, is hormone therapy right for me? Just
mhm.
as Tina mentioned, like it wasn't right for her. So is it right for me? So identify that. And then what type of therapy do you recommend based on your symptoms and health history? And that gets specific to you and not what's generalized from that. Next, ask your risk factors. What are the risks and the benefits?
Mhm.
Everything we do, even when we're going to go in and we're going to talk about lifestyle things as well, everything has a risk, everything has a benefit. We always want our benefits to outweigh our risk from that. So, talk about those things. And then ask, how long can I safely use it from it? That's always a question. So, dive into that as well. And can I try it and stop it if I don't feel better from it? So important. So just remember those 5 things can even no matter what if you're talking about hormone therapy or I'm going to go buy a new house. What it is,
Yeah.
we're going to talk about those things from that. So nutrition is key. What I talked about before, things that we can do naturally to kind of really heal our body and our hormones from that. Oftentimes you always hear like I want my hormones to be balanced from that.
Mm,
And I don't think balance is a word that I like to utilize for it because no matter where we are within our hormonal state, from it, even as teenagers, as we're gaining our cycles, and from it, our hormones are more of a coordination. There's times in our cycles where our estrogen is going to be low, where our progesterone is going to be high, and then they've kind of flip flop in between. So they are in good coordination, and that's what we want more of a coordination than it's a balance where they're equal piece of that. So there's that variation, which is key from those. I love to talk about our heart and our bone health that we mentioned before. Heart is so important. Again, the estrogen I talked about, so when we have those dips in our estrogen, puts her at higher risk for heart disease as well. So adding things like calcium and vitamin D from it, that's looking for like your bone strength for the risk of osteoporosis we talked about before. Green leafy vegetables, fortified milk, salmon, almonds, more sunlight. I mean, protect your skin though. Get you some sunscreen on when you're out there. Wear your brim hat if you're out somewhere hot, like if you're me in the desert. But that sunlight is so important. From it, whole grains, fibers, healthy fats. Again, helps to reduce that inflammation that we don't have with the estrogen from it as well. Again, decreasing those processed foods from it, sugary, salt, chemicals, alcohol, and caffeine as well can trigger your hot flashes and worsen sleep. So think about those as your lifestyle changes. Everything in moderation from it. A huge component is like don't go cold turkey and take something out from it because it's not sustainable. And we want to thrive in life from it. So everything in moderation from it and in small pieces and have to figure out what that coordination is for you. Sis, we're not chasing our youth from it. No matter what we can see out in when we open our front door, or even if we're in our house and we're watching TV or through social media from it, we can feel that we're chasing our youth from that. And we're not doing that. We're building strength and protecting our hearts from it and reclaiming our peace. You don't need to go out and run a full marathon outside or live in the gym 24/7. Just keep moving in ways that feel good for you and sustainable and joyful. Rather that's Zumba and things from it, or rather it's, walking outside or going for a run from it. Or maybe it's like, hey, I'm going to go to the zoo and that counts as my walking piece of that. Think about things that's enjoyable from that you desire. Walking is easy, it's gentle, it's powerful from it. So important in protecting your bone. Strength training, even if it's with light weights or bands, builds your muscle, which is so important as well. Protecting those bones. Yoga, oh my gosh, Pilates, stretching from it helps with our stress, our sleep, our joint stiffening. From it, swimming is low impact and easy on your joints as well. And dancing, I mean, oh my gosh, dancing can bring just so much joy. It calms your mood from it, gets you into a whole dancing in the rain from it. Even if you don't have any rhythm at all, girl, dance. Get your dance on and sing. Like get it all out from it as well. We carry a lot generational stresses, systematic barriers, family obligations from a, but we deserve to pour back into ourselves from that. So your nutrition and your movement are not only about discipline from it, they're about freedom, they're about energy, they're about longevity from it. It is
Yeah.
also, it's not about being perfect. It's about paying attention and learning what feels good in your body, treating yourself with the same respect and the same energy you give to everyone else from it.
I love that. You're getting me all pumped up. It's so funny. I tell people all the time, I know as women, sometimes we tend to, as you said, give kind of more than we take, right? It's almost like an expectation.
Hmm.
So a lot of times when I'm coaching people, I'll say, think about somebody that you really love. Like, would you move mountains for them? And they're like, yeah, of course. And I'm like, cool. What if you did that for yourself? What would change in your routine, in your habits, in the time you give yourself if you gave yourself that same kind of love? And most people are like, oh, right? Like, like, yeah, a lot would change. A lot of things
Yeah,
would change. And then, cool, let's take that first step, right? Maybe it's just one step tomorrow, or maybe you wait and want to wait till Monday, right? It's the weekend. Maybe
that's
it's
right.
one step on Monday, one simple change. And as we kind of start to come to the end of our conversation, I just love how you framed everything as, we're not going back. We're not going back to our 30s. That would be really cool, but we're not going back there, right? We're moving forward. We are moving forward into something much more powerful. And I think that something that a lot of women experience in this shift is that kind of mental viewpoint shift of I do feel more empowered. I do feel more ready to speak my mind and to stand up for myself. And that's a wonderful feeling, right? We have to just
Mhm.
get through these symptoms and figure out how to manage them, and so we can go out and continue to live our best lives. So I think a great way, we don't have any audience questions. I think a great way to end this, because you had this great section where you talked about gaining knowledge. What are some places where you would suggest that people go to find out more just about menopause, about what's going on with them, because it is such a barrier for women?
Yes, so important. Reliable and valid resources are so key from it. Start here. Our app within Stella is there. The key important. The Menopause Society from it is a great option as well. From that is there's tons of different podcasts and TED Talks that are available because sometimes we want to just put something in our ear while we're walking. I'm from it. You can multitask or listening things when you're driving with it. There's I love to journal from it. There's a lot of menopause journals that's out there from
Oh,
our even like general. The one that I have now that I'm journaling through um, is menopause in color from it, but it's an empowerment journal where you're writing things down. That's another way to kind of calm things, listen, write, writing it out with it. There's a ton of providers that are out there. There's this great TED talk. What nobody tells you about menopause, and it's by Shirley Wire. amazing. The piece of that to kind of really think, get you thinking. I think one of the other big powerful places to getting information is this past weekend. One of the things I posted was an encouragement to all women to go speak or talk to someone else about menopause from that, no matter what age that you're in. Because I think the more, if we, even if we're, talking to our children or our daughters or whatever it may be, at their 20 years old,
Yeah.
that's empower for them because they help them to prepare. Because raise your hand, who talked to you and your family about menopause?
No
From
one.
so,
No
so
one.
that yes, so that can be so key and so important, and it removes that barrier of feeling like you're in isolation from that, which is key. So go in and talking to people and hearing things in, but get in a source that's reliable and valid from it. Find a good book from it. I love to read and have tons of menopause books as well from that, but good following with it. But again, listening to your body is good. It fuels that. That gives you the data that you need, data you can share with others from it, and to really thrive in your journey.
Nice. We did get one question in, and we got one comment. One of you said, "Thank you for doing this today. There's so much to navigate during perimenopause." It's so true. I love how positive and empowering you are about this menopause journey. Yes,
Yes, thank
absolutely,
you.
absolutely.
We are
We've
in
been
this
there. We've
together.
both been
Yes,
there. So yeah,
I'm
yeah,
here.
we're here with you. And then we have one more question that says, "How do you know if you're approaching or reached menopause?" If you are on continuous progesterone that decreases or eliminates monthly bleeding? Great question.
That is such a great question from it, and one that's often asked a lot. It's like, hey, I'm on therapy, or I don't have a uterus anymore, so I'm not having
Mhm.
those cycles from it. And it gets back to symptom management from or symptoms that you're experiencing. What symptoms are there? Writing them down from that. There's also labs. So there's labs that we can look at as a provider to look and see where you may be within the spectrum, especially if we're looking at just from the menopause standpoint. I always like to caution folks with labs from it as well. Because remember when I talked about that our estrogen, our progesterone levels are they're up and down depending on where we are within our cycle or our month from that. So you get that same type of experience that's occurring. Even if let's say your uterus is gone, but you still have your ovaries that's there from it, or you're on therapy and things from it. So looking at where you are within your cycle, whether it's a natural cycle or just utilizing um, hormone therapy is key in when we look at labs from it. So what your labs look like on day 3 of your cycle or day 3 when you're starting medications may look totally different on day 15 or day 28. So that's key to put in. So I always like to encourage my clients. It's like, yes, let's look at these labs, but labs are a point in time, and we have to identify where that point of time is from that. So overall, labs can be a key point from you, specifically looking at what your follicle stimulating hormone is doing from it and what those levels are, because that's a huge component of letting us to like, oh, are we at menopause? Are our ovaries doing anything that's producing as well? That's also a key area if you've had a hysterectomy or you've had a oophorectomy, whether it's one or both the ovaries that's taken out from that can accelerate your time of going into menopause because it's induced because you wouldn't have those hormones that's there from it, but it's a key component.
Yeah, yeah, that was me. So I started menopause very early,
Yeah,
and it can be really hard to tell. So I appreciate that answer a lot. And mine was both, by the way. It was a set of labs, and it was also noticing when my symptoms shifted and changed.
occur. Yes,
It really was a identifiable shift in my symptoms that changed that helped me to know that okay, I think I'm past like the worst part. I'm past the worst
yes.
now.
And I always like that. I had a meeting earlier this week, and it was like they were already on hormone therapy, but we're still having some symptoms of the hot flashes and things as well. It's like, let's track it because you're tracking even when you're on therapy is so key because they can let me know as a provider. It's like hot flashes are increasing when it's time for the patch to come off. Oh, well, let's do a little bit more digging into a dive in. It can give you some specific information, whether it's tied to your cycle or just there's symptoms that are occurring, and you can see what that pattern looks like from it as well. You can get a little bit more individualized for you.
Great point. Well, we will begin to wrap up here. We're a little bit over time, but those were great questions. If you think of questions that you're like, oh, I wish I would have asked that, You can always email us. You can see on the slide. If you're in the UK, you can email us at hello@onstella.com. If you're in the US, you can email us at support@onstella.com. And we would love to help support your menopause journey. So if you're interested in getting started, you can see again on the slide onstella.com for the UK or us.onstella.com for the US to begin your assessment, get some wonderful care from providers like Shakika, and also some coaching, right? I'm there for you if you want to dig into those lifestyle changes and talk about how to make that happen. We are here. You are not alone. Thank you so much for joining us today. Dr. Shakika Mishra, thank you so much for joining us. It was so lovely to have you here to empower us and give us all this knowledge.
Anytime, anytime.
All right. Well,
Thank
thank
you
you. I hope
all.
you all have a wonderful weekend.